wanted to talk to you today about a new and growing condition called text neck. I would say the biggest way that this manifests is with headaches. So the tension that builds in the neck starts to cause tension headaches radiating around the head, and often people think it's their eyes or their sinuses causing those headaches, but it's actually originating from the neck. It can also cause numbness or tingling into the arms and hands, because the further forward those shoulders draw, you'll start to close off the nerve and blood flow into the arms and hands, and you get what's called thoracic outlet syndrome. The best thing you can do for all of this is early intervention. So by working both here and at home, you can work to correct some of these postures. Chiropractically, what we would do for this we would adjust through the neck, upper back, lower back, to help work on restoring normal alignment back to the spine, get that curve back into the neck, and get the head centered right over top of the body again. We also have to work with patients a lot on ergonomics and posture, because again, we can adjust all day, but if you're going right back to those same poor habits, it's going to be this constant cycle of pain. So training patients to correct posture when they're at their desk, lifting their monitor to eye level can really be helpful. Using a standing desk, if that's an option, so that you can have your arms nice and low, your monitor nice and high. A laptop is pretty much a no-no unless you're docking in to a separate monitor, keyboard, mouse, because with a laptop, no matter what, you're going to be looking down. Doing large amounts of work or playing games on your phone, also not a great idea, because no matter what, you're going to have that phone too low and you're going to be looking down. Or if you try to be good and hold it up high, that still causes a lot of neck and shoulder tension. So on your own, some things to be doing would be lose the electronics as much as you can, but I know that's easier said than done. Stretching out your pecs in the front of the shoulders is a great exercise to start with, and I'm sure you can find many of those videos where you're doing some chest opening exercises. Strengthening between the shoulder blades, called your rhomboids, is another great way to help pull the shoulders back and open that posture up. Often if you just correct your posture across your chest and shoulders, the head will naturally fall back with it. Sometimes if a patient has perfect upper body posture, but they still tend to jut their head forward, we can work on strengthening these muscles in the neck, called your deep neck flexors, and that helps to retract the head back into that normal alignment as well. So basically our goal is to keep as little stress and strain to the musculoskeletal system as possible, so that it functions like it was designed to.